Nobody is arguing that if there was an emergency, you would need to see a doctor. I work in that field myself in acute care hospital medicine. Obviously, if there's a very serious condition, if you're dealing with infection, sepsis, whether it's a traumatic injury, broken bone, as Dana White said, nobody's arguing that you would want to go and see a doctor. It is with everything else that the problems arise, which is all about prescribe, prescribe, prescribe. Oh, you see a patient coming through the door, your prescription pad is half out, wanting to be written on or typed these days to give a medication, a chemical to put into the body. This paradigm is completely and utterly broken, and we are going to realize it one day. Doctors nowadays, when they go through medical school and they receive all the propaganda training, they are not taught to think in terms of root causes. It is very easy to pull the wool over the eyes of any practicing physician. Doctors at the front lines are merely pawns in this whole process. How on earth did the medical profession, how did the minds of doctors become so broken, where they think that the answer to everything is to pour chemicals into people, never look at root causes, never think about true health and well-being? You see, up until relatively recently, doctors were much more in tune with real health and well-being before the medical profession got completely bought out. A few decades ago, you would go to a doctor and they'd say, look, what's going on? Go on a holiday, get outdoors, eat in a common sense way. What you're eating now is unacceptable. I remember when I was young, a child, wasn't that long ago, doctors were full of that type of advice. Nowadays, oh no, absolutely not. Here's a pill, here's an injection. And the ironic thing is that we've always known this in medicine up until relatively recently. Hippocrates, the father of medicine, 2,500 years ago, if you read what he wrote, he was all about looking at the true root causes of illness and how the true health of anybody is rooted primarily in what they eat. And even 100 years ago, if you were diagnosed with type 2 diabetes, you would have a far greater chance of reversing it successfully, because a doctor would be very blunt with you and tell you that you absolutely have to make changes. Now it's all about medications, while your illness keeps getting worse, whether it's type 2 diabetes or any other type of inflammatory illness. Doctors want to prescribe their chemicals. And feeding yourself into the medical industrial complex, that is what happens. And this whole line from the medical establishment, from doctors, oh, we can't do anything about the problems of society and what people are eating. What a whole load of nonsense, a whole load of tosh.